Bismillah ar-Rahman ar-Rahim. Greetings from my institute. Topic for today's discussion is role of Acotiamide in the management of functional dyspepsia. We know the functional dyspepsia is defined as chronic dyspeptic symptoms without an identifiable structural cause on upper GI endoscopy. There are two types, subtypes of the functional dyspepsia according to room 4 criteria, and one is postprandial distress syndrome, PDS, postprandial distress syndrome, which is characterized by early satiety with post-meal fullness. And then the second subtype is that of epigastric pain syndrome, EPS, which is characterized by epigastric pain or burning unrelated to meals. So, we know the functional dyspepsia, the PDS, postprandial distress syndrome, and epigastric pain syndrome. In couple of patients, they may coexist rather. They may happen as a separately or they may coexist. And in almost 40% of these patients, they have both elements, the postprandial distress syndrome and epigastric pain syndrome. And this is the different studies from in overall 61% of the patients they have the postprandial distress syndrome. The 18% of the patients they have got the epigastric pain syndrome, and in 21% of the patients there is overlapping. Similarly, studies from the USA, the general prevalence in the population was 12% of functional dyspepsia, and out of these, the 59% of the patients they had postprandial distress syndrome, while 16% of the patients they have epigastric pain syndrome, and 25% has got the overlap. Similarly, studies have reported around 8% of functional dyspepsia in general population from Canada, and out of these, the 63% they were having the postprandial distress syndrome, 21% they were having this epigastric pain syndrome, and in 16% it was overlapping, comprising symptoms of both these two conditions. From UK studies report 8% prevalence of functional dyspepsia in general population, and in these 63% were having the postprandial distress syndrome, 17% were having epigastric pain syndrome, and 20% of them they were having overlapping. So point is that in overall as well as from US, Canada, and UK, the most commonest subtype of functional dyspepsia is postprandial distress syndrome, and that is 61, 59, 63, 63. So almost 62%, 61 to 62% of the patients, or 2/3 of the patient, they are suffering from the functional postprandial distress syndrome. And even in the rest, in 1/3, almost half of them, they are having overlap. So the overlap with the epigastric pain syndrome. It means in 61% it is isolated postprandial, and in another 21% total it becomes 83% here they are overlapping with the epigastric pain syndrome. So it's really the major, the functional dyspepsia almost means postprandial distress syndrome. So the Acotiamide, it's a prokinetic agent. Mechanism of action is that it inhibits acetylcholinesterase, and it leads to increase acetylcholine at neuromuscular junctions, and thus it enhances gastric motility and emptying. It regulates gastric accommodation reflex, reducing postprandial bloating and discomfort. And it modulates 5-HT receptors, contributing to visceral pain relief. So the primary use of acotiamide is in the postprandial distress syndrome, which is a subtype of functional dyspepsia, and I told you almost 82 to 83% of the all patients of the functional dyspepsia, they are having postprandial distress syndrome. In 60%, it's an isolated, and in the rest, 21-22%, it is in combination with the epigastric pain syndrome. The clinical evidence, I just would like to refer to this study published in 2012, and it was a placebo-controlled trial of acotiamide for meal-related symptoms of functional dyspepsia. Objective of this article was to determine the efficacy of acotiamide, an acetylcholinesterase inhibitor, in patients with functional dyspepsia in a 4-week trial, and the authors concluded that over 4 weeks, acotiamide significantly improved symptom severity and eliminated meal-related symptoms in patients with functional dyspepsia. Then another trial, again, that is the 2018, a long-term safety and efficacy of acotiamide in functional dyspepsia postprandial distress syndrome, results from European phase 3 open label safety. And in this trial, this European phase 3 open label safety trial has been conducted to evaluate the long-term safety of acotiamide and explore the efficacy of acotiamide on PDS symptoms using the validated LPDS quality of life using SF36 and SF NDI and work productivity using WPAI. This European phase 3 open label safety trial has been conducted to evaluate the long-term safety of acotiamide and explore the efficacy of acotiamide on PDS symptoms using validated LPDS quality of life using SF36 and the SFNDI and work productivity using the WPAI. So, significant symptom relief in postprandial distress syndrome of the patients, and it improves early satiety, post-meal fullness, and gastric motility. What is the dosage and administration? The typical dose is 100 milligram orally 3 times daily before meals. It is given for 4 to 8 weeks depending on the response. It's well tolerated with minimal side effects. And those side effects, which are its mild gastrointestinal symptoms, diarrhea and nausea, rare hepatic dysfunction. So in long-term use, LFTs must be monitored. Possible headache or dizziness may be there. The contraindication is severe hepatic or renal impairment, and hypersensitivity to acotiamide are its components. So the clinical insights of use of acotiamide in functional dyspepsia is it's more effective in postprandial distress syndrome than epigastric pain syndrome. It works synergistically with PPIs in some cases of refractory dyspepsia. And it has better tolerability compared to classic prokinetics like domperidone or metoclopramide due to lack of dopamine antagonism because there is no extrapyramidal side effects. So key takeaways from today's discussion is acotiamide is unique in functional dyspepsia because it targets gastric accommodation, whereas most others primarily enhance motility. So with this, I pay thanks to your kind listening and being with me. I hope in today's session, I was able to explain to you the role of acotiamide in functional dyspepsia, and its role is in the postprandial distress syndrome, which is almost 80 to 82% of the patients with functional dyspepsia they suffer from. I end here. See you in the next vlog. Till then, take care. Khuda Hafiz.